epidemic and some solutions that we're putting forward. The obesity is an epidemic in Illinois. It's a public health crisis. We have 2/3 of adults are overweight or obese in Illinois. 1/3 of children are overweight or obese, and headed toward long-term obesity. A lot of diseases are resulting from obesity. So we have people who are with heart disease and some cancers and strokes and diabetes as a result of this obesity crisis. And while these diseases are taking a real and frightening human toll, they're also costing us a lot of money in terms of healthcare costs. So the estimate is that obesity alone costs Illinois $4 billion or more in healthcare costs. So that's in public healthcare spending, but also for employers and others who are funding healthcare, people who individually are paying for their healthcare. So it's really a fiscal crisis and a health crisis in Illinois. And sugar-sweetened beverages are the single largest source of sugar in the American diet. And they are, every day we get more research that shows the link between sugar and obesity, and actually directly now to some of the diseases, even for people who aren't overweight or obese, direct links between sugar and heart disease, and actually mortality from heart disease now. They're very harmful and dangerous. And sugar-sweetened beverages our bodies react differently to those than to the sugar that we eat. So when we drink sugar, our bodies react differently, and that's why we think it's really important to address sugar-sweetened beverages. They are the single largest sugar. Sugar is harmful, and our bodies are reacting differently, and we're having worse outcomes because of drinking sugar-sweetened beverages. So our goal at the Illinois Alliance to Prevent Obesity is to ensure that obesity trends stabilize by 2015 and begin to move downward by 2018. It's a multifaceted problem with no silver bullet. It's not just the tax that's going to solve this, but it's the way that we're going to invest the revenues from the tax in the HEAL Act that we're talking about today. We have a lot of supporters for this, including the Heart Association, the Cancer Society, the Illinois chapter of the American Academy of Pediatrics, the Illinois chapter of the American Academy or American Family Physicians, and we've come together to endorse this bill today. The HEAL Act, which HEAL stands for Healthy Eating and Active Living, the HEAL Act raises $600 million for prevention programs like bike paths and walking trails in communities, healthy school lunches and physical education in schools, healthy child care centers, farmers markets, community gardens, a lot of actually proven and evidence-based strategies for addressing the obesity crisis. In addition, the HEAL Act puts the $300 million, the other half of the revenues, into Medicaid. And this will help us increase the prevention services in Medicaid and help to sort of lift some of the budget crisis that Medicaid is facing. Also restoring the adult dental services to Medicaid, which were cut about a year ago, and I know of great concern to a lot of folks. So I'd really like to introduce our sponsors for the HEAL Act, Senator Mattie Hunter and Representative Robin Gable. We're very grateful to them for their strong interest and advocacy for this, and I know they have some interesting things to share with you. Senator Hunter? Well, Robin. Okay.
Good morning. Good morning. So I am very pleased to be here and very pleased and proud to introduce this legislation, which is projected to produce over $600 million each year for prevention, wellness, and Medicaid services in the state. We know our communities are suffering, as Alyssa said, from obesity, diabetes, heart disease, and cancers, and it's critically important to address these health concerns and generate revenue to invest in solutions to these complex problems, especially in communities disproportionately impacted by these diseases. Now, this won't be an easy bill to pass. Some will say it's all about moderation and exercise. But the reality is that a person needs to walk 3.3 miles to work off just one 20-ounce soda. I think that Alyssa Bassler spoke about why sugary added drinks are the target, and I think it makes a lot of sense. Now, the plain truth about this issue is that this bill will save lives. It invests in prevention and in Medicaid and by reducing the consumption of sugar-sweetened beverages. One study showed that the penny per ounce tax could reduce child obesity by 9% in 1 year. It could reduce the number of cases by diabetes by 3,400 cases, and in the process save Illinoisans over $150 million in healthcare costs in just 1 year. Combine that with the prevention and Medicaid investments, and the reality is that we can't afford not to pass this bill. I'd now like to invite Senator Mattie Hunter to say a few words.
Good morning. I, too, am very happy to support this bill. I represent the 3rd Legislative District. I'd like to thank you, Representative Gable, for saying the wonderful words that you've just spoken. My district basically has been disproportionately hurt by obesity, diabetes, and heart disease epidemic, as well as all the cuts in the health services over the past several years. So I am so excited to introduce this bill. It will be very difficult to pass. You know, I must be honest with you. But you might hear some say that the bill restricts choices, which of course it does not. Every single drink that people can buy now, they will still be able to buy it. It'll be available, so, when this bill passes. Not one product will be removed from the shelves. Not one person will be told they can't buy something they want. People will pay a little more, it's true. But that is just to help offset the burden of those beverages in terms of health and the health care costs here in Illinois. And others will say that the tax is regressive and it hurts poor people. Well, I'll tell you. What hurts poor people? The extra marketing that these drinks in poor and minority communities, that's what hurts us. The extra deaths from diabetes and heart disease in poor communities. The lack of safe places to exercise and healthy places to eat in poor communities. The cuts in Medicaid for the poor, that hurts the poor community. This bill is one of the most progressive initiatives I have ever had the opportunity to sponsor in the 11 years that I've served here in the General Assembly. We urge my fellow legislators to join us in working to heal Illinois' healthcare crisis. Let's pass the HEAL Act and turn a public health problem into a public health solution. Thank you very much.
Good morning, and I'm Radine Cox, and I am a lead volunteer for the American Cancer Society's Cancer Action Network. That is the advocacy part of the American Cancer Society. I am also delighted to be here today to show my support of the HEAL Act. ACS CAN supports a broad range of evidence-based strategies to prevent and reduce obesity, foster healthy behaviors, and remove barriers to healthy living in order to reduce cancer incidence and death rates in our state or in our country. The obesity epidemic in Illinois is apparent. Obesity is a major risk factor for many chronic diseases, including several types of cancer. And while we have made great strides in the cancer fight, as death rates for many cancers are declining, future progress in reducing death rates from cancer and other chronic diseases is threatened if evidence-based strategies to reduce obesity are not put into place. Although many factors influence rates of obesity, sugary drinks play a significant role. Sugary drinks have become a regular and large contributor of added sugar to our daily diet, which provides excess calories without any nutritional value. I am a lung cancer survivor, and I now understand what it's like to eat and drink healthy. Obesity has always been a problem for me. I have now stopped all intake of sugar-sweetened beverages. I know this as an addiction, the same as tobacco was for me. Research shows sugar increases the risk of cancer along with the obesity. So now I am trying to talk the talk and walk the walk. Now is the time to put health of Illinois residents first. The HEAL, Healthy Eating, Active Living bill will not only encourage people to rethink their drink, but it will generate much needed revenue to support programs that encourage health and wellness. So I encourage members of the General Assembly to support this bill. Thank you.
Good morning, everyone. My name is Bridget Williams, and I, like you, function in several roles. Four of my most important roles are that of wife, mom, daughter, and nurse. Even though these roles are very different, my priorities and concerns for preventive health, healthcare costs, and continued quality of life are constant in all of these roles. As a wife and mom of three, Ashley, Jason, and Joshua, the health of my family is of utmost importance to me. With two teenage boys, otherwise known as our human food vacuum cleaners at home, I want to make sure I not only make healthy decisions on behalf of my family, I want to make sure I teach them how to make good decisions and build healthy habits for the day they eventually leave our nest. When that day occurs, I hope my efforts will arm them with tools they need to make their own healthy lifestyle choices for them and eventually for their own families. The proposed sugar-sweetened beverage tax will not only provide an extra incentive for me to make healthier choices for my family, it will save money in our family budget when I choose to infuse water with fresh fruit for my children rather than buying a soda or some other sugar-sweetened option. When we make better choices today by encouraging our children to develop healthier habits, we reap the benefits over the long term by helping them avoid many of the debilitating diseases caused by obesity. As a daughter, I unfortunately witnessed my mother suddenly die at home at the age of 42 from heart disease, likely caused by her lack of a healthy lifestyle choice. As a result of her death, I have been and will continue to be a strong advocate for promoting a healthier lifestyle and committed to improving the quality of care for all. Now, I'm not only a wife, mom, and daughter. Like I said, I'm also a nurse with almost 21 years of experience in various healthcare settings. In my current role, I continue to see patients from 35 to 95 suffer from debilitating diseases like diabetes, heart disease, and stroke, often as a result of obesity that could have been prevented had they made better lifestyle choices. This needs to change. Now let's be clear on what this bill is and what it isn't. This bill is a tax on sugar-sweetened beverages, not food. Moms like me will still be able to choose other healthy drink options for our families like water, which by the way is free. I believe the proposed tax, coupled with other health policies and initiatives that will be supported by this new revenue, will encourage people to make healthier choices and improve our country's health outcomes for generations to come. Thank you.
Good morning. My name is Tom Hughes. I am the Executive Director of the Illinois Public Health Association, and I'm pleased to be here with Alyssa, Senator Hunter, Representative Gable, to endorse on behalf of the association the passage of this bill. The Illinois Public Health Association is the state's largest and oldest public health association. We have more than 7,000 members across Illinois. We represent many local health departments. One of the reasons why we're so involved in seeing this bill pass is that health education has been dramatically cut across Illinois, and health education is one of the ways in which we can modify and change behaviors. I also have type 2 diabetes. I know firsthand what it is like to have to manage this disease. Anything that we do to help educate the public and to inform the public of the dangers of sugar-sweetened beverages for the long term is greatly important. Dental health is greatly important. Many of our local health departments also are invested in providing oral health And we have to say that sugar-sweetened beverages do nothing to help children and their oral health. So the monies and the revenue that would be coming to local health departments for health education is greatly needed. We appreciate it, and we're about making your community healthier. Thank you very much.
Good morning, everyone. My name is Ramon Garnhire, and I'm the Deputy Director for SEIU Healthcare Illinois. And we are enthusiastically here to support the HILL Act along with Senator Hunter and Representative Gable. The HILL Act helps put investments back into the communities which have been severely hurt by some of the cuts that you heard about earlier, in terms particularly to Medicaid. As a union representing healthcare workers, we know the importance of investing in people to stay healthy rather than treating them once they're ill. We also know that these cuts to Medicaid have been devastating, and this bill will help restore investment in some of the most critical services which have been cut in the Medicaid program, such as adult dental. New research shows this proposal would actually create jobs. And in the packet that you guys have, a study is in there from the University of Chicago that was published last week that shows that this bill will create about 44,000 new jobs in Illinois. 4,400, I'm sorry, 4,400,000 new jobs in Illinois. Well, wishful thinking, yes. So again, SEIU Healthcare Illinois, Indiana, stands in support with all of our allies in encouraging the General Assembly to pass the HILL Act.
We'll be happy to take questions.
So what chance do you think it has going through a committee in a chamber and then the other committee and chamber and the governor?
I'm Mark Pasikovich with the American Heart Association. I'll take that.
Can you spell both Mark and Pace?
Sure. Mark, M-A-R-K with a K. Pasikovich is long. I'll give you a card, but it's P as in Peter, E-Y, S as in Sam, A, K-H-O, V as in Victor, I-C-H.
That should be in a spelling bee.
That burns a few calories. So first of all, to address its chances, we're not kidding ourselves. This is the first year of a significant campaign. I compare this sort of quite a bit to our work on tobacco taxes. And if you can say that, for example, tobacco is, sort of a middle age to retirement age adult, this issue of sugar-sweetened beverage is probably a toddler. So it will take some time to break through, especially the industry advertising. The industry has the dream team. They have the Michael Jordan, Shaquille O'Neal, and Kobe Bryant of lobbyists covering this. So first of all, I'd like to say that as far as jobs go, I think we've created quite a few jobs here at the Capitol for lobbyists for the industry. But aside from that, it's going to take time to get the message across, but we feel that the public will finally support us. And, anybody playing defense on this issue has already lost. It's just a matter of time now, and that's what our other campaigns show us on issues like this. If you're having to explain why you're opposed to this, then you're already back on your heels.
Well, I think we all know what pop is, or soda, depending on where you live. It's got sugar, high fructose corn syrup in it. But beyond that, what's covered and what's not in this bill?
Sure. So the bill is soda, as you mentioned. It's also would be drinks like sports drinks, the sweetened teas and coffees that are out there, the energy drinks that we see a lot of, and fruit drinks, which are also, actually a lot of people are very confused, in fact, about fruit drinks. They think they're healthy because they have pictures of fruit on the boxes. They're not. They're really a lot of sugar in those as well. So those are the major categories of sugar-sweetened drinks that are covered, and it's covered both in containers and also the syrups and so on that you use in fountain drinks to make them.
Now, you said fountain drinks. Are fountain drinks covered in this law?
The syrups that are used to the bill. We should say the tax is what's known as an excise tax. So it's a tax on distributors rather than a sales tax after the consumer buys them. So yes, the syrups that make fountain drinks are covered under this. And the effect of putting the tax on as an excise tax is that the cost of the tax is on the product when it's on the shelf. So there's a difference between buying an unsweetened beverage and a sugar-sweetened beverage because of the tax, and it's meant to encourage people to choose the healthier option, which all of the same companies make. So we're just asking people to switch their choices between different beverages here.
If I could just add to that, the people, I'm a human being. I have an 11-year-old, and yet I sometimes sin and like to take her out for junk food. And, parents being what they are and human beings being who we are, we very often look at the short-term cost, at the cost of something on a shelf when we're reaching for it at the grocery store. We're not thinking about the long-term cost to our kids and to their health. Nobody is thinking, I'm reaching out for a bottle of diabetes. And so we need to hit them. We need to remind people of those costs as much as we can at the point at which they're making a decision on what to buy.
So when you say healthier options, do you mean a drink sweetened with maybe an artificial sweetener as opposed to sugar?
So yes, artificially sweetened drinks aren't taxed under this bill. The science and what physicians sort of recommend is that people use those drinks as a kind of transitional drink to something healthier, but they are not taxed because the science and evidence is really there around the health effects of sugar. I want to remind people that this is like a sort of two-part bill. So part of it is the tax, and there is a health effect for the tax. But the other part is where the revenue is going, because we know it's not just one thing. The sugar-sweetened beverages are one of the primary problems that we're facing in terms of people's nutrition. But the investment from the tax in the HEAL Act is in a lot of programs and efforts at the community level to change the physical activity, physical amount of physical activity people get, physical activity in schools, the nutritional value of lunches and so on in schools. So we're taking the resources from this and investing it in the very multifaceted aspects of addressing obesity, so that we're not saying there's a one answer to this. We're trying to address the multiple answers that we see as contributing to it. I don't know.
In terms of the things that you're going to reinvest in, which one would you might want to focus on? Like, which one does evidence say has the biggest return on investment?
And I wish we had someone here from the schools. The way that the bill is written, the co-chairing of the advisory committee is the Illinois Department of Public Health and the Illinois State Board of Education, because we think, in particular, investing in schools and in young children is one of the primary. There's a lot of evidence that getting kids to move, getting kids opportunities to move in school, getting kids to eat healthy in schools is one of the really critical investments that we need to make. And schools are strapped. I'm pretty sure the teachers are here to talk about challenges in school funding. So I think that's an important area of investment. And then, as Tom said, health departments do a lot, both in working with their schools and the rest of their communities to promote prevention.
So a banana is healthier for you than a donut, and water's healthier than Throwback Pepsi, and PBS's Nova is better for you than MTV's Jackass. We all agree on that. But where does my own choice stop, and this is a nanny state because the government knows best for me, begin?
Well, I think Senator Hunter said this isn't going to affect anyone's choice. Everyone will still have the choice to do what they want, to drink what they want to drink. This is not about choice at all. This is about encouraging healthier choices and, frankly, investing in public health, funding schools, funding nutritious meals in schools. That is the job of government. Right, and we don't have the resources in other places in the budget. I mean, if point to me where in the budget we could put more resources into the public health kinds of things. So, this is the job of protecting the public health on the investment side and Medicaid. These are the jobs of government. So this is not affecting choices, and it is doing what the government does and investing in important role that the government already has. Is there other questions?
And I just add that we see this not as a choice issue, but as a truth in pricing issue, truth in the cost of the product.
Well, those are all great points.
We have other. Did you have a question?
Sorry.
Is this something that you're just bringing up because of income tax expiring, just trying to look at another way to bring income into the state?
No, we're not. I mean, I think we have really targeted where we want the revenues from this to go. So it isn't, the Medicaid investments would help to shore up some of the budget issues that we're facing, but this isn't unconnected to the expiring income tax.
And although it's,
Senator
oh, sorry.
Also, let me just say that when I was a freshman in 2003, I passed, one of my first bills I passed was an obesity bill, because when I was a freshman in 2003, there was a magazine, and I can't recall the name of it, that stated that Chicago was the fattest city in the nation, and I was very concerned about obesity. I was concerned about prevention. By profession, I am a certified and licensed alcohol and drug counselor, and for the past 30-something years, I have been committed to preventative measures. And so we see this tax as prevention. We are committed to investing in human capital, okay? And so the programs that we're talking about funding are very near and dear to all of our hearts. We know that they work. We know that prevention works. We know that an ounce of prevention is worth a pound of cure, and research clearly state that. Now, we had not thought about the tax that is soon to expire. I didn't think about it until you mentioned it, but if you look at my record, I've supported legislation as it relates to health and human services probably for the past 30-something years. I know I look young, but for the past something years, so 30-something years, So this excise tax is a continuation of my efforts. I have a health and fitness fair every single year. This year is our 10th year that we're doing it. Many of our colleagues, we now have a diabetes caucus that is bipartisan. All of these guys are committed to addressing chronic diseases and preventative measures, and many of my colleagues are now instituting health and fitness fairs in their districts on an annual basis. And so that's the shift. That's the direction in which we're going in. We want our children healthy. We would like to have a future for our children. And it's in the health. Because if your health is not good, you can't function. So that's it. Thanks.
One more question just about when we talk about choosing and making healthier choices.
Sure.
Prevention. I think you made the comment, the gentleman over here, about liquid or reaching for a bottle of diabetes. What about the people who say, well, if I go in and I buy a drink sweetened with an artificial sweetener, I'm reaching for a drink that might be liquid cancer or some mysterious illness because we don't know enough about artificial sweeteners in drinks?
Well, that is why the programs are going to be instituted, is to educate not only our children, but educate the general public. We will have grassroots community awareness and educational programming. We'll have it in the schools. We'll have it in the communities. We plan to hold town hall meetings. We plan to bring in professionals, such as our nurse over here, that can help educate our students in college, our adults. You must educate the parents in order to get to the children. And so this is going to be a major effort on our part. So that will address that issue as well. Thank you all very much. I'm sorry, you had a question?
Do you think it would be difficult to convince the legislature to put that $600 million in revenue toward obesity rather than any of their other problems?
Well, that's where we're targeting. I'm sure that our colleagues would like to use those dollars elsewhere, but no. The money is going towards prevention programs. We've made a commitment in the bill, and we plan to stand by it.
And I think, we recognize the budget challenges, so that's why half of the money goes to Medicaid, because we do recognize that there are But we think that this is, it's a health equation that we're making here, and we really want to stick with the health equation. But there is a substantial money for Medicaid to help with the budget issues. I know that's a concern of yours.
Just one additional thing with regard to cancer or other things or choice. I represent the American Heart Association. We are the largest non-government, non-industry funder of stroke and heart research. So the same research that we do on this also informs cardiologists who treat you when you go to a cardiologist. So we think our research is pretty good and pretty credible. And at this point, the research is increasingly shows that an increase in the sugar-sweetened beverage tax is a low-hanging fruit intervention. That is, in and of itself, it's likely to do a lot more than a lot of the other negative choices people are able to make. So, as the people who advise cardiologists on how to treat patients, our science shows that sugar-sweetened beverages are the primary first step at this point.
Thank you very much. Thank you, everyone.
What's your last name? Basson. Basson. Right, Alyssa. In many places in the state, like in the inner city of Chicago or in other urban areas like Decatur or Champaign or Danville, and then other places, there's a different challenge between the people who are sick in poverty in those places where it's very highly concentrated